completing your assessments today, I want to go ahead and give you some oral health care instructions for you to go ahead and follow. To begin, I want to go ahead and recommend that you brush your teeth twice a day, once in the morning and once after work. Right when you get home, you can go ahead and brush your teeth for 2 minutes. I did notice here that you do work the night shifts, which is sometimes very difficult for workers to go ahead and get that last toothbrushing in just because you are tired. You do want to get some rest, but it is very important for you to brush your teeth right before bed to remove any plaque or any food debris that might still be left in your oral cavity. Now, when it comes to a toothpaste, I want to go ahead and recommend Periodontax. I did notice that you are diagnosed with diabetes. Um, Periodontax does contain stannous fluoride, which is great in its activity against caries, plaque, and gingivitis. Now, when it comes to using a toothbrush, I want to recommend that you use an electric toothbrush. This will go ahead and um, brush your teeth for you, because I did notice you are diagnosed with having arthritis on your hands. Using a normal manual toothbrush can sometimes be difficult and be painful for you, and thus using an electric toothbrush will go ahead and make oral health care routines easier. And you could always use a normal soft bristled manual toothbrush. And when it comes to a toothbrushing method, I want to go ahead and show you the Stillman method, which is placing your toothbrush or electric toothbrush at a 45-degree angle. This will go ahead and place the bristles subgingivally to remove any plaque or debris that might still be left in your oral cavity. And just do some vibratory motions over 2 to 3 teeth, all over the maxillary. And then when you're done with the maxillary, move on to your mandibular teeth, both facially and lingually, for 2 minutes. Once in the morning, and then once right when you get home from work. Now, I did notice here that you are diagnosed with having arthritis on your hands. What I recommend is, when you have a toothbrush, you could buy a tennis ball and insert it onto the handle, which will go ahead and make toothbrushing easier for you. Now, because you are diagnosed with diabetes, you do have an increased chance of having cavities, gingivitis, periodontitis, but also xerostomia. Xerostomia is a dryness of the mouth, which can sometimes be very uncomfortable for our patients, and it also increases the chance of our patients getting cavities. So something I want to recommend is using Biotene, which will go ahead and relieve that dryness of the mouth, make things more comfortable for you, and also reduce the chances of you developing cavities, which is what our main focus is: avoiding cavities, gingivitis, periodontitis. Lastly, because you do have arthritis, using normal floss may sometimes be difficult, painful, and frustrating. So I want to go ahead and recommend using a water pick. This will go ahead and use water to go ahead and remove any debris, plaque that might be interproximally between your teeth, and it will make the overall experience of brushing your teeth much more easier, and you might even look forward to go ahead and brushing your teeth at the end of the day or in the morning.